According to the World Health Organization, public health refers to the public or private measures to prevent disease, promote health, and prolong life among the population as a whole. Its activities aim to provide conditions where people can be healthy and focus on entire populations, not just individual patients or diseases. Thus, public health is concerned with the total system and not just the eradication of a particular disease. Public health professionals monitor and diagnose the health concerns of entire communities and promote healthy practices and behaviors to ensure that populations stay healthy. The risk assessments of communities, policy making, and healthcare promotion are the three main functions of public health. Water quality is an important part of public health that is often taken for granted or overlooked by developed countries. Addressing water quality issues as soon as they arise is essential to protecting the public health and safety of communities around the world.
Dr. Jim Malley is a professor in civil and environmental engineering at the University of New Hampshire. His focus over his career since 1980 has been providing safe drinking water for people around the world. Outside of UNH, he serves as chair of the American Water Works Association Technical Education Council. Dr. Malley has helped bring clean water to 1.4 billion people.
One of the unfortunate scientific and engineering realities in dealing with the public is that the things the public would see in their glass of water that would trouble them are usually color, turbidity, like a cloudiness, maybe an off taste, maybe an off odor. But the reality to water quality professionals, quite dramatically I guess I could state, the things that generally can harm you a great deal are tasteless, odorless, and colorless.
The saying, "what you don't know won't hurt you," does not apply in the public health world. Colorless and odorless contaminated water is a serious threat to drinking water because it makes our sense of smell, taste, and sight helpless to protect us from consuming something potentially harmful. A few harmful odorless and colorless contaminants are lead, arsenic, and radon. All have the possibility to cause serious health problems and potentially death in extreme cases. According to the EPA, lead is the most serious to children under the age of 6 because their developing bodies absorb more of the lead in the water, resulting in more serious health problems. A recent example of this is Flint, Michigan, which had some lead levels so high some people were found to have more than twice the normal limit. Many children are now suffering from memory problems, brain damage, and behavioral complications, and many more symptoms as a result from lead poisoning. Arsenic exposure through drinking water can cause reduced immune function, cardiovascular disease, diabetes, and some cancers. Radon in water is much less of a problem waterborne, but has a small chance of causing stomach cancer. Overall, these harmful contaminants can be consumed unknowingly by the victim, which makes them so lethal.
So, as you might realize, the number one water use in a home is not drinking or cooking, never has been. It's laundry and showers and irrigation, if you're watering lawns or gardens and stuff like that. That's the volumetric big user. So we use water to cook our food, personal hygiene, of course some drinking of it, the lawns, the irrigation, the water, of course, in an industry goes into our products. The whole waterworks industry talks a lot about an industry's water footprint because we know a lot about an industry's carbon footprint. Most industry also has a water footprint. So we talk a lot about that. For example, it takes a lot of water to make electricity, and it takes a lot of electricity to pump water around. So those two items together we call the water energy nexus. They come together.
In general, people use much more water than they realize. In addition to drinking water, the society we live in demands an astounding amount of water for food, energy, and basic comforts. For instance, the Water Footprint Network estimates that it requires 1,847 gallons of water to produce a single pound of beef. Excluding drinking water and food from the equation, the United States Geological Survey estimates the average American uses almost 100 gallons of water a day due to washing dishes, yard maintenance, bathing, toilet flushes, laundry, and general hygiene. The water used for these purposes needs to be of similar quality to the water that we drink.
I think it's an unfortunate situation. I think it's almost a perfect storm. I think some people, for reasons that are totally unknown to us, were negligent. They really were. And of course, there'll be many lawsuits.
The Flint water crisis was a very unfortunate event which affected the health and lives of many people. According to the findings of the Flint Water Advisory Task Force report, the Flint water crisis is a story of government failure, unpreparedness, delay, inaction, and environmental injustice. The Michigan Department of Environmental Quality, or MDEQ, and the Michigan Department of Health and Human Services failed to protect public health and failed to enforce drinking water regulations. The MDEQ stubbornly worked to discredit and dismiss others' attempts to bringing the issues of unsafe water, lead contamination, and Legionnaire's disease to light. This is not unlike what happened in An Enemy of the People, which was discussed in class, as Michigan's environmental and health agencies blatantly disregarded the concerns of engineers and officials for economic and easier alternatives. Neither the governor nor his office took actions to reverse the decisions made by the MDEQ due to reassurances that the water was safe. The consequences of these negligent failures in Flint will be long-lasting and have majorly affected the public health, economy, and government of Flint.
Almost anywhere in the world, there are some exceptions, but almost anywhere in the world, a problem gets more expensive if we wait. There are a few places where that isn't true, but it's usually because of a major technological advancement.
When a threat to a clean water supply arises, many question the best time for intervention. In nearly any case, waiting to act only exacerbates the situation and in turn increases the monetary cost of resolving it.
I think the truest statement in the world is time is money. Another way to put it is pay me now or pay me later.
As seen in this graph, the idea of pay me now or pay me later has a great deal to do with the medical toll that results from water quality problems. In areas where such issues are addressed and resolved generally quickly, less people have the opportunity to experience the adverse health effects of the situation. On the other hand, if the issue is not handled in a timely manner, contaminants can spread further throughout the water system and therefore can affect more people. In this case, though symptoms may not always occur immediately, contaminants such as chemicals, inorganic toxins, and heavy metals can accumulate in the body over time. Accumulation may take place for a variable number of years before symptoms become apparent, but the end results could be as devastating as cancer, birth defects, or neurological disorders. For those living in Flint, Michigan, who recently discovered unusually high amounts of lead in their bloodstream, this fear is becoming a reality.
If we can get across to people that we're really all connected, if there's a significant dump something in your stream, you're going to affect an awful lot of people who use that stream for their drinking water, or that stream recharges their well, the groundwater. So I would say just getting people to be more aware and then to manage their waste practices better. And lastly, what we always try to do, and it's hard in New Hampshire because we've been so fortunate to have all this water, is if we could promote water conservation. That's a big help. Use less water. Turn the water off when you brush your teeth, or don't leave the hose running when you're washing your car, or whatever it might be. Use less water.
Dr. Malley also suggests that you not dump unnecessary things down the drain. Remember, your sink and your toilet are not the trash. By pouring chemicals, paint, and other toxic materials down the drain, you are risking the water supply. When you flush non-degradable products, such as tampon applicators or baby wipes, you can disrupt the sewage treatment process, resulting in littered water and beaches. When it rains, the water often makes it to storm drains and carries with it some unwanted substances. Cleaning up after your dog prevents the bacteria-laden materials from their waste from getting into your water supply. Additionally, limit your use of pesticides, herbicides, and fertilizers to prevent the same issue. By running the dishwasher or clothes washer only when you have a full load, you can help conserve water. Lastly, if you notice a problem with your water supply, report it. The Clean Water Network and Waterkeeper Alliance can help you get connected to a local environment group. By adopting some of these practices, you can help keep our water clean.